Ms. Stacy Weeks, UNLV President Dr. Chris Heavey, our distinguished guests, and all of you to the fantastic Kerkorian Medical Education Building. This state-of-the-art building that is the home to the School of Medicine is the result of the shared vision and true partnership. It was designed and constructed by the Nevada Health and Bioscience Corporation on land that was provided to us by Clark County for the School of Medicine to be placed in the Las Vegas Medical District. The Kerkorian School of Medicine was established to be a transformational force for improving and growing healthcare in Nevada, and also to be able to serve our students, our patients, our healthcare professionals, and our community. We are very grateful to Governor Lombardo's shared commitment for improving healthcare in Nevada, which is the reason that we're here today. We welcomed our charter class to this School of Medicine in 2017, and since then, the School of Medicine has graduated 5 classes, including our class of 60 that we graduated last Friday and held our celebration at the Thomas and Mack Center. I'm happy to say that all 60 of our recent graduates successfully matched into residency programs, which is a testament to the excellent caliber of our students and the strength of our curriculum that is delivered at our School of Medicine. I can also share that 42% of our graduates are going to be continuing their residency education here with us in Nevada. Unfortunately, that means that 58% are going to continue their training outside of Nevada, which really emphasizes our need to be able to expand residency education to help us retain our homegrown physicians that have committed to their education in Nevada so that they can be part of our solution for combating our healthcare worker shortage. We are excited to be able to collaborate with Governor Lombardo on his vision to expand graduate medical education and address the workforce shortages in healthcare through growing partnerships and continued targeted infrastructure investments. So you're going to hear from other folks today that will tell you more about these really fantastic opportunities. But now it is my distinct pleasure to introduce Dr. Chris Heavey, who is an accomplished academic leader, a distinguished researcher, and our president at UNLV.
Well, thank you, Dean Netsky, and like the Dean, I am so honored to welcome the Governor to our beautiful medical education building at the Kerkorian School of Medicine to talk about a topic that's so important to this community. Before I start, I do want to welcome 2 of our distinguished guests. We have from the Nevada System of Higher Education, Regent Jennifer McGrath, and from the Nevada System of Higher Education, Vice Chancellor for Health Affairs, Marcia Turner. Thank you for being here. At UNLV, we know that we exist to improve the well-being of this community. And one of the things that we understand, after 80 years of explosive growth in the Las Vegas community, we have always struggled to keep up with the number of healthcare providers that are needed for Southern Nevada. And so we're so happy to have now this new School of Medicine here. And what we know is we need partnership with others to be able to not just train the residents here, but as the Dean said, have them train the undergraduate students here in undergraduate medical education, but to have them continue their residencies here. And we're so happy that the Governor recognizes this urgent need, because what we know is that students who do their residency and their undergraduate medical education here stay in Southern Nevada. 80% of them will end up practicing here, and that's what we need is more doctors for this community. So, as the Dean said, we're honored to have the Governor and his staff here to talk about this important new bill and how we can partner on growing graduate medical education opportunities for our graduate and medical students, and so we can keep more people here. And so I'd like to welcome Governor Lombardo up to the stage. But before I turn over the microphone, we do have a little token of our appreciation for our double UNLV alum from our medical students to show how much we appreciate the governor being here today.
All right.
Will you do a quick picture? Jump around here. Thank you, Governor Lombardo.
Thank you very much. Josh, don't touch that. I was just telling Dr. Heavey when in the back, my back hurts, and he said, well, you could probably find a doctor here today. So, I think it's exciting. Let me know, where's Dana? Let me know if they're doing rabbit ears behind me. All right? All right, before we get started, I want to make sure we give due thanks to Dr. Heavey and Dr. Netsky. Thank you for allowing us the opportunity to participate in this press conference in this great facility, and thank you to the Kerkorian Foundation and the Ingolstadt Foundation and everything they did to accomplish this great feat. This is something you could be very proud of, right? The ability to promote what we're trying to do in academia and the medical world and be able to say we are best in class in what you're trying to achieve, so thank you. And I was a little nervous too, another full disclosure, and quite often I get admonished by my communications director, I go off script too much, but I had the opportunity to meet Dr. Netsky in the back, never met her before, and unfortunately we were in the middle of the conversation before I asked her what her specialty was, and it was psychiatry. And I became very nervous, and so I'm sure I'll get an evaluation at some point here. So it's an honor to be here with current healthcare leaders, and it's an honor to be here with the medical students. Thank you. Thank you all for being here. And our future healthcare leaders and visionaries. I'm also joined here today by Stacy Weeks. Stacy, can you stand up? We're going to talk more about her in a few minutes, and after she completes her comments, I'm sure everybody's going to want to give her a rounding, sounding applause because she is one of my key administrators in state government. And everybody's going to soon remember her name as what we're trying to achieve through the healthcare process. She's also one of my best partners, right, Stacy? So we had a discussion in the back too about how complicated the medical system is and the need to have a double PhD to understand the insurance that goes along with it, let alone trying to get an appointment with a doctor. So, and pre-authorization and all the stuff, but she's the expert and gives me the knowledge that we need to write a very comprehensive piece of legislation to address the needs here in the state of Nevada. And just to give you a little background and color on how my administration has conducted our business, as you know, we have more than one comprehensive bill going through the legislature. And they're very large bills because it affects a very large swath of the population in the entire state. And it would be malpractice can I use that word in here? Malpractice. It would be malpractice for me to try to author or write legislation that didn't include all our subject matter experts and the people that are the benefactors of legislation. And so, and I've said this to the press, and I know you know this, we bring people that are the experts in the field from the community prior to the legislative session, not just people internally to state government. And the reason behind that is we don't have all the answers, right? And we don't know all the unintended consequences, all the hidden threats associated with bad legislation. And we did the same today for the Health Care Act. And it's important for people to know it's not done in a bubble, and it's not done strictly in my mind, because if that was to happen, it would be poor legislation. but it's my goal to push it forward as the leader of the state. With that being said, Stacy's going to provide an in-depth introduction prior to my comments and subsequent other individuals speaking. At the end, we will take some Q&A. Be nice when you take the Q&A, and we'll get into further of that. So with that, it's a pleasure to introduce the Nevada Healthcare Access Act here today. Adequate health care remains a pressing challenge for many Nevadans. No secret. Right now, Nevadans seeking medical care face long wait times and have trouble accessing specialists. The need for more doctors, nurses, and healthcare providers is increasingly evident. We're introducing this legislation to help grow our healthcare workforce, expand mental health services, and streamline healthcare services across Nevada. The Nevada Healthcare Access Act seeks to build and support our healthcare workforce in several key ways. And bear with me as I walk you through this. First, the bill establishes the Nevada Healthcare Workforce and Access Fund, which is a $25 million annual fund to strategically address Nevada's critical healthcare workforce shortages. The bill, along with my budget, increases funding for graduate medical education residency programs. So a little elaboration on that comment, and Dr. Netsky mentioned it. If you don't have the residency programs here in the state of Nevada, where are these graduates going to end up? The higher percentage, the majority of graduates of residency programs, whatever state they occupy at that time, tend to stay in that state. And it's very important for us to realize that hurdle or that crutch and make sure we do something about it. And that's what we did in the last session. We're building on that exponentially in this session. And Stacy will walk you through some of the nuances of that. And Dr. Knight will also do that. This will help attract top talent like those sitting behind me and address critical provider shortages in underserved areas. The bill accelerates the state licensing and credentialing process for healthcare providers. The bill also increases access to dental care by expanding training programs for dental hygienists and assistants, particularly in our underserved areas. Lastly, this bill will direct the Patient Protection Commission to complete a comprehensive study to assess the development of an academic medical center in Nevada, which will further help the state grow its future healthcare workforce. The Nevada Healthcare Access Act also expands access to mental health resources. The legislation creates the brand new Office of Mental Health, which would oversee mental health services across Nevada. Does that fall under you, Stacy? See, she said yes. The act also expands funding for community-based mental health services, which will provide critical support for individuals with severe mental illnesses. The Nevada Healthcare Access Act also aims to streamline healthcare services across the state. Central to this streamlined vision is the creation of the Nevada Health Authority, which I've tapped Stacy Weeks to lead. The authority will ensure a coordinated statewide approach to healthcare delivery. The bill also reduces administrative barriers to care by standardizing prior authorization processes and timelines, while ensuring prompt provider reimbursement. And lastly, the bill enhances Nevada's presumptive eligibility framework by introducing streamlined application processes and vendor-supported systems to improve Medicaid enrollment for eligible individuals. All good stuff, right? By bolstering and growing our healthcare workforce, expanding mental health resources, and streamlining healthcare services across the state, we're going to build a more robust, accessible, and sustainable healthcare system for all Nevadans. I look forward to presenting this bill to the legislature, and I'm hopeful that it receives bipartisan support in short order. With that, I'd like to invite Stacy to come forward, and I want to thank everybody for your participation today, and more importantly, I want to thank the press, because this is a difficult subject matter, that is hard to get to the people that it affects and have an understanding of the need within the state of Nevada and rely on their support in order that we move Nevada forward. So thank you very much.
Good morning. Thank you, Governor, and thank you to UNLV for hosting us today to talk about this important piece of legislation. The Governor's Healthcare Access Act provides several important changes to state law that are needed to address various weaknesses in our state's healthcare system. These weaknesses have gone unaddressed for many years. They have exacerbated the state's healthcare workforce challenges and stymied our efforts at the state to contain costs and improve quality in our system. If you may not know, Nevada ranks in the bottom in just about every health score nationally. We must do better. This includes rankings in access to care and outcomes. Currently, Nevada is 48th in how many physicians actively offer services per capita, alongside similarly low rankings for nurses and other healthcare providers. We must tackle the state's chronic workforce shortage before we can truly tackle poor outcomes in this state. As our state's Medicaid director, I've seen firsthand that improving access to coverage does help with healthier communities. However, what good is health insurance or coverage, even in Medicaid, if someone can't get to see a doctor when they need to, unless they are in an emergency? This type of system only leads to higher healthcare costs and poor health outcomes. Thanks to Governor Lombardo's bill, Nevada will begin to take critical steps forward in addressing many of these issues in our provider workforce. One is these important steps is the establishment of a Nevada Healthcare Workforce and Access Fund. There's a $25 million annual investment each year to fuel public and private partnerships with a clear focus on getting more professionals in healthcare into underserved and high-need areas. The intention is to have this program managed by the new Nevada Health Authority as is proposed by the governor to ensure accountability, transparency, and meaningful results. Secondly, the bill reforms prior authorizations, my favorite two words in Medicaid, most I hear about, so that those medical bills actually get paid and they get paid faster. This relieves, hopefully, a lot of the frustration that we hear from our providers and our patients about the burdens they face when they're trying to get access to care and get the bills paid. It also includes a requirement that all plans use a standardized electronic process for prior authorization. So this means for providers, simply that you don't have 5 or 6 or 10 different ways to submit your claims to get paid for services. You have one way and it will be streamlined. This new system will require all plans and payers to respond within 2 business days to a claim for a prior authorization request for a service. These reforms, or the hope of these reforms, is to reduce administrative burden to care and enable healthcare providers, our physicians, to focus on the care and less on paperwork and administrative delays. For patients, this will mean less time spent navigating unpaid medical bills and insurance hurdles, and more time focusing on their health, families, and recovery. Third, this bill will strengthen Nevada's graduate medical education programs. As the governor mentioned, there are huge investments this legislature that the governor has proposed for lawmakers. This bill will also streamline administration of the GME program under the new Nevada Health Authority. And as the governor mentioned, we know that if students do their residencies in this state, they're more likely to stay in the state to practice, and that's the goal of this bill. Another key aspect of this legislation is the creation of an Office of Mental Health to expand access to appropriate mental health care statewide with a focus on shortages in our mental health care workforce. This new office will be housed within the Nevada Health Authority and provide a single point of leadership at the state level to champion mental health initiatives and ensure statewide coordination and collaboration between localities and state government entities. And finally, the bill seeks to reduce administrative barriers for providers within state government and the private market and ensure timely access to care. This includes provisions to accelerate licensing and credentialing processes, which is another thing I hear often about. Healthcare providers often have to go through multiple processes, lots of paperwork, and it takes months, if not half of a year, to get into practice. so they can finally stop worrying about all the hoops and hurdles to practicing and getting approved to practice, and instead focus on actually providing the care that Nevadans need. Together, these measures and other healthcare priorities, such as creating the Nevada Health Authority, reflect the governor's unified strategy to build a more robust, accessible, and sustainable healthcare system in Nevada, and to finally move us to the top 10 in healthcare outcomes nationally. Thank you. And with that, I'm going to introduce Dr. Knight, who's going to give us some more statements on the bill. Thank you.
Hi there, everyone. I'm Dr. Nike, and I'm a practicing emergency physician here in Southern Nevada. Let me tell you a story about what the reality of healthcare is like here in Nevada. As a physician practicing in Nevada, I witnessed firsthand some of the serious harm caused by our current prior authorization system. Every day, patients experience delays in care due to unnecessary bureaucracy. These delays aren't just inconvenient, they can lead to worsening outcomes, unnecessary suffering, and poorer health outcomes. Nevada already faces a severe physician shortage. We can't afford our limited number of doctors to spend precious hours on the phone fighting with insurance companies instead of being where they're needed most, with their patients. Prior authorization removes doctors from exam rooms and ties them up with red tape. The consequences of these for patients are real and alarming. A colleague of mine recently shared a heartbreaking story. He was taking care of a 6-year-old male patient with failure to thrive. What does that mean? He wasn't growing well. He'd been given a medication called Migestrol to help with his appetite stimulation, been on it for multiple months, and he returned to normal size. Partway through the treatment, the insurance company stopped covering the treatment. My colleague made numerous appeals, and all while the child started to get worse. As an emergency physician, I see this firsthand. My wife, who's a gastroenterologist, had a patient with Crohn's disease who was waiting for prior authorization for a newer medication to treat their disease. The insurance company only covered older medications, which the patient had already failed. The current standard of care shows we should be including these new medications called biologics, and it's what this patient needs. In the interim, the patient started to get worsening abdominal pain, bloody diarrhea, I know it's hard to see on camera, weight loss and vomiting for weeks to months. It's terrible, but it's the reality. Patients ultimately sent to me, because she calls me over the phone, it's an in-house call, to the emergency department due to their persistent worsening symptoms. The patient shared with me the frustrations of dealing with insurance while in the ED. I provided her with IV medications and hydration, imaging, but the symptoms continue to persist because how could I fix something that had been going on for months now in a few hours? She needed admission to the hospital. This emergent care could have been avoided with timely intervention. When patients are denied or delayed care, they often end up in emergency departments like mine, in worse condition than when they first sought help. I even had mothers requesting prior auth, knowing that their children just needs glucose test strips for their child who has diabetes. It's something they're sadly born with or grow with. We have let a system like prior authorization get in the way of patient care. We have let red tape dictate when and how a patient is treated. That decision should be made between a physician and their patient based on sound medical judgment. That is why I'm grateful for Governor Joe Lombardo, who's championing a bold and meaningful reform to Nevada's prior authorization system. His bill is a significant step towards refocusing healthcare on where it belongs, the patient. Here's how Governor Lombardo's bill puts patients first. No prior authorizations on emergencies. The bill eliminates the need for prior authorization for emergency medical procedures, ensuring patients get access to timely care when they need it most, not worrying about it with future insurance battles. Second, a real-time and electronic system. The bill implements a streamlined electronic prior authorization process. During a visit, physicians will know immediately whether prior authorization is required. This allowed doctors and patients to discuss care options in real time, in front of you, to plan next steps together without unnecessary delays. For cases where prior authorization is still required, insurance companies must respond within 2 business days. This ensures that patients aren't left waiting in limbo for a critical decision, all while they get worse in their healthcare outcome. Fourth, reducing administrative burden. By modernizing and simplifying the process, this bill frees up time for doctors and healthcare teams. That means more time with patients and not on hold with insurers. The current prior authorization system places a heavy administrative burden on medical practices across Nevada. and their staff spends countless hours on phone calls, faxes, we still use faxes, and repetitive paperwork, time that should be dedicated to patient care. While prior authorization was originally intended to control costs in healthcare, its execution has become inefficient and costly in its own right. The administrative overhead now outweighs the intended savings, draining valuable time and resources from our healthcare system. This bill addresses the inefficiencies head on by streamlining the process and dramatically reducing wait times for prior authorization approvals. This legislation ensures that patients receive timely, appropriate care without unnecessary stress or delays. It allows doctors to spend more time at the bedside and less time on the phone with insurers, restoring the focus on healthcare where it belongs, on patients and their well-being. Governor Lombardo and your team, thank you for your vision and support. Let's get this done for Nevada. And with that, I'll hand it back to Stacy and the governor.
So that concludes the individual presentations, so we'll take the opportunity to take a few questions. And I can probably anticipate a couple of the questions, and one of them is probably the Trump administration and the situation associated with Medicaid, Medicare. So to head that question off, I'll have Stacy give us an update currently in that situation. So.
Yes, the federal bill came out a couple days ago. From a budget perspective, it does not look as damaging to the state of Nevada. I think we are still looking at it. Thank you, Governor. Looking at it today. There are some new program requirements for eligibility around work requirements, so we're looking at how that would affect the program, but overall, it is not as big in terms of cuts that we expected for the state. So that's the good news. So thank you, Governor.
And probably the second question is, when is my bill going to be heard? Well, it's getting introduced today. And so subsequently it'll get scheduled as part of the process. We all know we're in the short dog days of the legislative session, but I have an agreement in cooperation with leadership that we anticipate success here shortly. So, questions?
There have been some cuts at UNLV to grants, research grants. There's also a cut to a program run by UNLV Practice, which helps turn out mental health professionals, and the grant was used to provide mental health assistance to students in rural areas of the state, such as Elko. And I'm just wondering if that your fund would be appropriate to supplant some of that funding that was lost by Doge cuts.
Well, I wouldn't use the word supplant. That's a dangerous word in government process, but that's a continuing question or an answer and conversation that is occurring with Dr. Heavey and Dr. Sandoval, not Dr. Sandoval, but President Sandoval, identifying all those, whether they are going to be enacted or not, and how can we adjust funds within the system and the government to address those. But to answer your question completely, we don't anticipate the need to put it into this bill, because it's still nebulous. It's very nebulous. As we know, in the federal government system, they will operate on a different fiscal year than what we do as a state, and we'll have to make some of those decisions later in the year.
So you're saying the Doge cuts are not a done deal?
No, absolutely not.
Governor Lombardo, when you say you're going to expedite the licensing process, what exactly does that look like, and how quickly will we do that process?
Stacy or Dr. Knight, you want to talk about that? All right, go ahead, Stacy.
Thank you for the question. So in the bill, there are some concrete deadlines within like 72 hours and shorter for licensing with the medical board. It's going to be a more electronic process. There's also some timelines around credentialing, and we're already doing that now in Medicaid. So taking that and lifting that to the private market is what we're looking at.
Governor Lombardo, we've been hearing a lot about DUI issues, especially after the passing of an Arborview High School student. We currently have 2 Senate bills, including one that's part of your crime bill, that are currently stalled. What are you doing to make sure that stricter DUI laws are passed by the end of the session?
What am I doing?
What can be done to move forward
There you
these
go.
bills?
We're continuing to work on them. I haven't had a hearing on my crime bill as of yet, and neither has the two other legislators that have DUI and the statutes associated with DUI within their bills. We anticipate we should have a hearing on our crime bill early next week, and obviously, you know, there's people that have competing legislation, but as long as it moves us forward in what we're trying to achieve, I don't care who takes the credit. And we'll ensure that one piece of that legislation addressing that critical need you described will move forward. And it will receive my signature.
Governor, you mentioned expanding residency programs to keep doctors here, but if passed realistically, how long do you think it will be until you see the effect of higher doctor and patient ratios?
You want to ask one of these individuals? So, this could be a mandate for them to stay here or come back here, right? I don't know who's better to answer that question. I'm not well positioned to answer that question. Go ahead.
Stacy Weeks, sorry, I think I'm at the legislature, about to say for the record. I'm in mode. But no, we think it'll take at least a year to implement the new program and get things moving, but I would hope to get the GME committee meeting pretty quickly and starting to get some of these funds out into the community so we can get these programs up and going. We hear from our university partners that it does take some time to get the infrastructure developed, but we already have some sites that we could just increase slots at and start there.
Governor, another major concern for a lot of Southern Nevada families is the cost of prescription drugs. This Monday, President Donald Trump signed an executive order to try to do something to lower the cost of prescription drugs. What are you planning to do to also try to reduce?
Well, we have some bills that are going through the session as we speak, specifically addressing the PBMs. And so those will have an effect on that, whether it's capped or not, or whether availability is affected. So we'll have to see what those look like at the sine die. So we're being proactive. We're not ignoring it. And you know, quite often you hear people, you're in the pocket of pharma or whatever that may be. That is not the case. This is for the people in Nevada.
Governor, you've expressed some frustration at the pace of the legislation that you have sponsored this year. Has that gotten any better?
No. But I'm confident we still have enough time. We still have enough time. And, you know, sometimes you think it's personal as the governor and, you know, and whether if it's a partisan issue, it's not the case. As the legislative session is very cumbersome because it's a short period of time, and you continually want to remove the need for a special session, but the bills have to ensure that they're appropriate and they're complete and comprehensive and of the intended sponsor. The language mimics that. So that's a very long, drawn-out process. What we experienced in this session is unique, is because we've had, you know, a lot of federal funding in previous years and a lot of ability to act on funds that are available. In this session, we don't have that luxury. And unfortunately, the timing of the economic forum is late in the session, the second meeting of the forum, which being May 1st. And it makes you difficult to make decisions, especially in your budgetary hearings and bogging down and not making decisions and the language you anticipate in your bills, whether it has a fiscal note or not. So waiting for what the economic forum brings forward. As you know, in the state of Nevada, I have to act on the economic forum's projections and submit a balanced budget. So there's a lot of moving parts. Some parts that we moved forward with in the early throes of the legislative session were for naught. Now we have to make adjustments depending on the numbers that were projected, and we will work through that process. It seems like it's personal, but it's not. I have constant communication with leadership. I'll dispel that rumor out there that I'm not communicating with leadership. The communication, the partnership is adversarial. That is not the case. We are in constant communication, and they're advocating for their folks too, as I advocate for my position. So it's part of the process.
Governor Lombardo, in the last legislative session, you approved the $100 million funding towards the the Campus for Hope, to tackle homelessness in the community. I know part of that is addressing mental health and providing health care and different resources for individuals to get them off the streets. How vital is this in really tackling homelessness in our community? And what is your response to, we have some community members giving pushback saying they believe this will bring more crime to the community?
Well, let me answer. I'm very proud of that program. We put the working functionality of it in the last session. This session, during the interim, we had to raise the money to address it. So it's public-private partnership to the tune of $100 million from each entity. So that was based off the programs that were produced out of San Antonio, a similar, project, and it bred success. And so we brought that same idea, and I'm happy to say the director of the San Antonio facility is now the director of this facility here in Las Vegas, state of Nevada. And in the Board of Examiners, as early as a couple days ago, we just approved the leases for the property. And for public clarification, that property is up in the area of the community college up off West Charleston. It is an existing facility, existing use that is occurring there. It's just going to be a better use of the facilities and the resources that are available. A lot of the angst from the members or the neighbors or the residents of that location is based off lack of a communication. And I ensured that the people involved in that project have done some robust communication here in the last few weeks to quell that angst and give them a better understanding of what the project exactly is. And you're right, if you bring in social services into particular areas, that's a concern of residents, and that's a proper concern. But in this case, those social services are already present in that location. It's just a build out of that. And so, and you're also right in describing it as a great program. What you deal with the social issues, obviously, is resources, the lack of resources, and the inability to affect a certain population because of lack of resources. This is bringing those resources to bear to help with the problem. Is it the ultimate solution? No, but you can't ignore any solution. So.
Governor, you said
Last question.
You said that you were, monitoring the activity at the congressional level to try and limit the possibility of a special session. What kinds of policies are you looking at to see whether you may need to call one later this year?
Well, one was the outlier with the federal government, and Stacy gave me some solace that what they have presented here recently is not the case that everybody feared, and we're going to be able to work around what was presented, and we can do that internally. The other one was, is there some emergency issue occurring that we don't have the time to hear it completely in the legislative session? And I would attune that to healthcare. I would attune it to education. I would attune it to housing. And I'm confident we will be able to get there.
So you're saying if your bills are heard, I feel that
No, well, that's a good way to describe it. Well, it's a bad way to describe it. Let me say it that way. But it looks like that is the case. But as you look through the legislative process as individual legislators and what bills they individually present, they encompass those three subjects. Because polling data, talking to their constituents, those are the three key functions in this cycle that we're dealing with as society and the state of Nevada. So it's important for people to realize that. To go into a special session without an emerging or emergency need is not necessary. If it becomes an emergency, like we're not addressing housing, we're not addressing education, or we're not addressing healthcare, that's another conversation. I want to thank everybody for being here today, and I want to thank, more importantly, is the students and the faculty and what we're trying to achieve in this space. And I'm sorry to take you away from your studies. I'm sure that your instructors will give you a pass. But this is one of the most important things we can do for our community and the state of Nevada. So thank you. gosh, can't have this. Thank you. Appreciate it. Everybody have a great day.
Thank you.